Hello, everyone. Today, we're going to talk about the future of healthcare. But this isn't some far-off science fiction story. It's a future that's already unfolding all around us. A future where our health isn't just measured in doctor's visits, but is understood moment by moment. I want you to just think about this for a second. What if, instead of you having to go to the hospital could come to you, right into your home, into your living room? What would that even look like? Well, like I said, this isn't just a dream anymore. This is happening right now, and it is changing absolutely everything about how we think about care. You see, we're in the middle of this huge shift. For so long, healthcare was all about reacting to sickness. Now, it's becoming about proactively keeping us healthy. And this whole revolution is being powered by smart, connected devices. So let's break down the 5 biggest trends that are really driving this massive change. Okay, our first trend is probably the one that feels the most personal. It's this idea of the hospital at home. This is all about tackling some of healthcare's biggest hurdles, like making it easier to see a doctor and just making care way more convenient. You know, think about the old way. You'd get these little snapshots of your health, a checkup here, a visit there, maybe once or twice a year. But the new way, it's like a continuous conversation. Thanks to things like remote patient monitoring or RPM, your doctor can see what's going on with your vital signs in real time. It creates this constant connection that just wasn't possible before. And what's so fascinating is that this change isn't just being pushed on us by new technology. We're actually asking for it. A staggering 80% of people say they would much rather get care in the comfort of their own home. It's what we want. And the results? Well, they really speak for themselves. You've got 81% of clinicians already using this tech. But the really amazing part is this. Some programs are seeing up to a 70% drop in hospital readmissions. Think about that. That means people are staying healthier and safer, right where they want to be, at home. And all of this is being made possible by these simple but really powerful little devices. We're talking smart blood pressure cuffs, tiny glucose monitors for people with diabetes, wearable patches that can track your heart, even smart systems that make sure you're taking your medication on time. Each one is another piece of the puzzle, bringing that hospital-level care right to your front door. All right, so for our second trend, let's look at what's happening back at the hospital itself. Because while care is moving into the home, the hospital is getting a serious upgrade. It's almost like it's developing its own digital nervous system where everything is connected, everything is talking to each other. Check out this number. Just by being able to track equipment in real time, hospitals have cut down on lost or misplaced gear by around 35%. Now, that's not just about saving money. Think about the nurse who doesn't have to waste 20 minutes searching for an IV pump. That's more time they get to spend with you, the patient. That's what really matters. So when you start connecting everything, the pumps, the ventilators, even the hospital beds, the hospital can suddenly see exactly what's going on instantly. And that means fewer equipment failures and patients getting the care they need faster. The whole place just becomes safer and way more efficient. And this isn't just theory, right? It's happening right now. We have smart beds that can tell if a patient is about to fall and get help. We have systems that can find any piece of equipment in seconds. We even have MRI machines that can predict when they're going to need maintenance before they break. The hospital is becoming this smart, living system that solves problems before they even happen. Okay, trend number 3. Let's bring the focus back to you. Because those smart devices we wear every day, our watches, our rings, they're not just for counting steps anymore. They're becoming serious clinical tools that are telling the unique data story of your body. And here is the real game changer. Instead of that one health snapshot you get at the doctor's office every few months, these wearables are giving us thousands of snapshots every single hour. This gives doctors this incredibly deep understanding of what's happening in all those moments between your appointments, and that's usually where the most important stuff happens. This is where it gets so personal and so powerful. For someone with diabetes, a glucose monitor can be a lifesaver. For heart health, an ECG-enabled watch can catch a problem super early. Even for something like asthma, smart inhalers can track patterns and help prevent an attack. It's turning healthcare into this daily collaboration between you and your doctor, all guided by your own body's data. Now, with all of this amazing connected technology, there's a really serious side we have to talk about. And that brings us to our fourth trend. Security. Because if our health is going to depend on these devices, we have to be absolutely sure they're safe. Protecting this network isn't just an IT problem, it's a patient safety issue. And here's the tricky part, right? The very same device that could save your life could also become a vulnerability. Every smart monitor and every wearable is a lifeline, but it's also a potential doorway for a cyber attack if it's not protected. This quote just puts it all into perspective. We're not just talking about one device getting hacked. A single weak link, like one unsecured infusion pump, could potentially open up an entire hospital's network to an attack. It shows you just how high the stakes are. But the good news is the industry is fighting back, and they're fighting back hard. They're using strategies like zero trust, which basically means nothing on the network is trusted automatically. They're splitting up networks so a problem in one area can't spread. They're constantly monitoring every single device. They are, in effect, building a digital immune system to protect our physical health. And that brings us to our fifth and final trend, which honestly is where everything we've talked about comes together beautifully. It's a whole new model of care called the virtual ward, and this is where the hospital really truly comes home to you. Just look at the difference here. It's not even close. The cost of caring for a patient in one of these virtual wards at home is so much lower than a traditional stay in the hospital. We're not talking about a small savings either. This is a complete game changer that makes high-quality care so much more sustainable. And this model is just a win-win-win. It frees up hospital beds for the people who are the most critically ill. It costs 30 to 50% less. And just like we saw earlier, over 90% of patients absolutely prefer it. So it's better for the healthcare system, it's better for the budget, and it's what people actually want. So as we finish up, I just want to leave you with this final thought. We've looked at the technology, we've looked at the data and the trends, but the real question is much more personal. When your own home becomes the safest, best place for you to heal, what does that really mean for how you live your life? Thank you so much for joining me.